M2TV.square.
Content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027. We're a Medicare certified home health care agency in Palm Beach County, Broward, and Miami-Dade. I'm your host, Louise Gomez, and today we have Dr. Bilga Attar, who is right here at Boca Raton Regional Hospital, right off of 800 Meadows Road. Phone number is 561-750-8809. Dr. Attar, welcome to the show. Thank you so much for coming.
Thank you.
You know, you have such an impressive background and resume, and I was going to read it, and I said, you know what, I think we get to discuss this because you have such a rich background. I know you originally from New York, and then your parents were doctors. Can you tell us a little bit more about your background?
Well, I was born in Turkey, and
nice.
Our parents, we came to the United States in 1958.
Okay.
Both of my parents were physicians in New York City, in Queens, at Triborough and Queensboro Hospital.
I know the area well. I'm from Queens.
And we actually grew up in the hospital grounds with nurses and doctors.
Wow.
And we were blessed. And my parents moved to Buffalo area, Gowanda, and that's where I went to University of New York and Buffalo. And I graduated first with a chemistry degree, and then I went back for a pharmacy degree.
Okay.
So I became pharmacist for about 7 years, worked at Sloan Kettering Memorial Hospital.
Oh, yeah. Very good hospital.
And then finally I came to Florida, to Deerfield Beach.
Okay.
Right across from Century Village.
Okay.
And I have to thank Century Villagers because they drove me crazy. And
so that was the catalyst. That was the catalyst for you to say, all right, I got to move on, right?
Move on to get another degree. I wanted to be a medical professional for a long time.
Good for you.
So I went packing up, and I met with Dr. Stein, Jeff Stein. I think he's also in Florida.
Okay,
here in
nice.
Boca Raton. So we went to American University of the Caribbean.
Nice.
Which is in Montserrat, undergraduate for 18 months there, and then
Beautiful.
We moved to London, England for our third year medical school.
Wow.
And the fourth year I spent in Boston, medical training in Boston, Georgetown, and Tampa. And I finished my residency in JFK in Edison, New Jersey, in family practice.
I was going to ask you, so what, family practice? Okay, nice.
It's associated with Robert Wood Johnson School of Medicine. So finally, I came back down again to take care of the Century villagers. So,
But now you're taking care of them on at a different capacity, right? Because originally
Yes.
you were doing the pharmaceutical
physician.
right? So what is the so I know you're in Boca Regional. What are the what's the demographics of the people that you see? Is it
I
Geriatric?
started mostly as geriatrics, and finally I had an office in Boca Raton.
okay?
And one day, one of the patients called me from a nursing home.
Okay.
So I went to see the patient, and she called me again. So I went to see the patient again.
Okay, I have a
And-
quick question.
yes.
Sorry to interject. Was that a formality, or was that something you were doing? Because you said I went to see the patient.
No, I had a small office at
Okay.
Meisner Park
Okay.
initially. And I went to see the patient, and they assigned me a few more patients. I said, sure, I'll see them.
Okay.
No problem. And then finally it grew and grew. I said, this is probably where I need to be. And I started going to rehab centers to see the patients
Nice.
there.
Nice.
And they're long-term patients. Now we have what they call as subacute. These patients in the past, we used to take care of them in the hospital.
Okay.
But now the hospital sends them to
The rehab.
the facilities, rehab, before they go home. They're challenging, and they're still not well enough to go home.
Now, do you also make recommendations when you think they should go to the rehab, or
No, we're assigned from the hospital.
Okay.
They send the patients to different facilities, and they'll assign me the patients at the facility,
Okay.
and I'll see them, get them better, send them home.
So what you prescribe to them what you think is going to be the quickest route for them to leave? Because nobody wants to be in the rehab. They want to get out, right?
They want to be home.
They want to be home.
They want to be home. I know.
Right.
Well, and in rehab, we work with physical therapists, occupational therapists,
Nice.
speech therapists.
Nice.
Besides their therapy, they need medical management with their chronic congestive heart failure, COPD. It may be exacerbation of their COPD. So we take care of that kind of patient, get them stabilized,
Okay.
and preferably when they go home, if they do need more help, we'll ask for a home health agency to follow them at home.
So a quick question. When they're in the facility and they have they're presenting with multiple things, a lot of different medications. So
This is where I
that's where
this
you-
is where I
this is
come
where you
in.
step
That's
in.
right.
Okay.
You know, I'm all for everything. They'll see 5 consultants
Right.
at the hospital.
Right.
Cardiologist, pulmonologist,
Right.
hematologist, infectious disease. Lo and behold, they come to these facilities. So I have to go over all their medications
Wow.
and the problem list. From their hypertension, congestive heart failure. Next problem would be uncontrolled diabetes. Next might be anemia, etc. So we have to monitor these patients closely.
Yeah. So you have a big responsibility. It sounds like you are. It sounds like you're managing people that have multiple things going on.
Just
right?
like the old days, the hospital, when we would be taking care of these patients in the hospital
Right.
in the old days.
Right.
Now it's in the rehab centers,
Okay.
and they get better and they go home.
So do you feel that has been a step up in the right direction? Because you're saying the old days we did it like this, so I'm curious
Yeah,
because you've been around, you have a lot
yes,
of experience,
yes,
Dr. Attar. Tell
Well,
me, what
I
are we
think,
going in the right direction? People want to get better quick, you know?
I think we are going in the right direction. They should be in the hospital, but if we can take care of them at home,
Okay.
most patients want to go home, obviously.
Absolutely.
But some cannot go home. So this is where the medications, the therapy,
Right.
and the medical management comes in. As soon as they're stable, then we can bring their care home. Actually, this is what I'm trying to now go into.
I was going to ask
It's,
you, what's your vision? What's your vision for the future, Dr.
I think there's a
Attar?
big need
Okay.
for a physician and nurse practitioners to see some of these patients follow them through at home.
Okay.
Some of them are not capable or incapacitated,
Yes.
and they cannot go out.
Right.
So this would be, I think this is what we need.
Well, I will tell
this
you
point.
what, from my experience of interviewing doctors on this show, the couple of doctors have these types of practices where they do the home visits. And the last doctor that was here explained to me that they're doing studies and they're realizing having home visits actually saves money, because normally a lot of doctors, a lot of patients ends up saying, I'm just going to go to the ER. I'm just going to go to the ER. And they go to the ER for everything.
Right.
And they flood the ER
Right.
with, you know, all these
Exactly.
visits. So I think
Exactly.
having what you're suggesting sounds like they've done the analysis, and it sounds like it's something that would be trending towards that direction.
I think so. We have now telemedicine, which is a good thing.
Okay.
But there's nothing like a physician listening to the patient's heart and lungs,
Right.
especially with congestive heart failure, COPD. Then you have to prescribe a different regimen for the patient. And along with home help and home health,
Right.
home physical occupational therapy, I think that might be a good way to go eventually.
And we're gonna take a commercial break in a minute, but when we come back, I want to be able to touch on this conversation a little more, because I feel like there's a lot that family members want to do to be able to support the you know, the patient that's in the hospital. So when we come back, maybe we can discuss a little bit more about how we as family members can support the patients that are there. So we're going to take a quick commercial break, and we're going to be right back. Alrighty, thanks.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. We have Dr. Attar right here at Boca Raton Regional Hospital, right off of 800 Meadows Road. Phone number is 561-750-8809. Thanks for joining us today, Dr. Attar.
It's my pleasure.
You know, you have a lot of experience, and what I wanted to ask you, I think a lot of people want to know, because if there's a family member in rehab or in the hospital, you know, what are some things that maybe a family member can do to support that senior or that person who's in the hospital? Because, you know, sometimes you have all these different members wanting to do, you know, I want to do this, I want to do that. And so what is, from your experience, what do you think is a good way the best way to support a patient who's going through these traumatic life changes, you know?
I think a positive attitude, giving them some hope, is one way. Making sure that their family member is comfortable in a sense that their pain management is well controlled.
Right.
And the
Important.
family members need to be more educated, more realistic with what is going on. Usually I'll see the elderly patient.
Right.
They'll come in and they'll have multiple medical problems.
Right.
And trying to explain everything to them. I take my time with that. It takes a while
Sure.
to bring them to reality. A loved one is 90 years old. There's a 90-year-old heart there.
Right.
What the expectations should be.
Right.
What's going to happen in the future with some of our patients.
Right.
Like stroke patients or Parkinson's
Sure.
patients expect that this is probably going to occur,
Right.
so that they watch out for the signs and symptoms when the patient goes home. To look for things like aspiration, are they coughing while they're eating, sort of educate the family
Sure.
more
Sure.
to comprehend what's going on.
I think it's important because so many people, you know, it's a major life change when you have a family member going through, a medical situation like that. So it's important for the family to be grounded and reasonable as far
Yes.
as expectations.
That's
right?
true.
Yeah. So, Dr. Attar, you've seen a lot of patients, and I want to ask you, I always love to ask my doctors, if you can talk about lifestyle and how important is a healthy lifestyle? What are some lifestyle tips you can recommend? And what does it look like, a person having a healthy lifestyle? What are some tips and ideas that we can suggest to people?
I think staying active mentally and physically is the best lifestyle.
Okay.
Staying active would be, of course, having some kind of daily exercise.
Okay.
Secondly is, of course, the diet, what you eat. Preferably, I think everyone knows at this point, is
Right.
best to have
Right.
things that are healthy for you.
Sure.
Stay away from red meat. I haven't had red meat in 40 years.
Wow.
I know, it's just after
Wow.
anatomy class, well, it's not that long ago, but
Wow.
I said, no more red meat.
Really?
Yeah, just fish, chicken, and turkey.
Uh-huh.
A diet is very important. Eat healthy vegetables as much as you can. I mean, we don't have that much time to elaborate on that.
Sure, sure.
Getting fresh air, getting sunshine, but to a point. You know,
Yes,
it's just
yes.
during certain hours of the day.
Right, right.
Keeping healthy, exercise, and keeping healthy in your mind to constantly be active. Try to learn things every day.
It's so important.
Very important.
Yeah, I love to do my daily Wordle, you know, the little crossword game where you have to, I feel like it's important for me to use my
is.
brain and just to be active, like you said, you know.
You learn new things every day.
Right.
And I get pleasure out of when I have my medical conferences. I go to a certain place, and it's amazing how things are just, there are new things, new findings, new drugs, a new way of treatment. It's amazing. So we learn all these. It's a challenge. I mean,
Are there any new treatments coming down the pike?
Oh,
I mean,
yes,
like,
yes.
what are some good?
Artificial intelligence. I don't know. You
us.
probably heard
Sure,
about
of
this,
course,
right?
Yes.
The gastroenterologists, for example, they use this artificial intelligence during their colonoscopy
Okay.
and their endoscopy, upper endoscopy.
Okay.
Where in the past they couldn't really see the detail, the minute detail of early cancer cells.
Okay.
Now they can detect it along with the computerized artificial intelligence. It'll light up the points that the eye cannot detect.
That's
And
fascinating.
they're doing this with different branches of medicine, not just gastroenterology.
Sure, sure. I think that's fascinating how technology is really growing so quickly and rapidly, and how we can effectively use it for maintaining a healthy, view on what's going on inside of us, right?
One thing I would like to mention about healthy lifestyle.
Yes, please.
Your best asset is your health.
Absolutely.
Your health. And don't neglect it. Doctor's visit to the physician should be at least, for an older person, I'm talking about 70 and over,
Okay.
at least twice a year, once or twice a year.
Okay.
And then get a good physician to really evaluate and check you out thoroughly. I hate going to doctors myself.
Oh, interesting. Okay.
But I do, and I have a marvelous doctor, Dr. Bruzo. She happens to be a friend too.
Okay, I'm sure.
But don't neglect your health.
Right.
You must see a physician at least once a year, if not twice a year. And if you have chronic illnesses, I would say maybe every 4 months.
Okay.
Chronic illnesses like congestive heart failure, COPD,
Sure.
poorly controlled diabetes mellitus. So that's a big one.
Yeah, it really is. It's so amazing how the basic things that we may take for granted or think, oh, that's so simple, right? Exercise and walking and,
Swimming.
swimming or whatever type of exercise and sunshine and just things that we think, that's it? It sounds so simple.
Basic.
Sounds basic, but back to basics. Back to basics.
true.
Our grandparents and whatnot, that's what they did.
When I went to school in Jamaica,
Right.
in New York City,
Right.
we used to walk to school.
Nice.
And that was at least, I would say, about 3-4 miles.
Nice.
Walking to school and coming
Sure.
home.
Sure. It's so important. I love my daily walks. For me, it's not only an exercise thing, but it's for my mental clarity. It clears out the clutter of my brain.
Exactly.
Yeah.
And also time out for yourself is so important
It really
from work.
is.
Once you're not here, nothing matters.
Right.
But you're first. And be kind to yourself, basically.
Yeah. It sounds so trite, but it's so true.
Yeah.
Be kind to yourself. These are all the things that, as we age and get older, I feel like that wisdom is there, and people, realize that,
Oh, we rush through life. I mean, especially in my field, rush to work.
Right.
7/24.
Right.
When I was at the hospital full time. But then time flies. You don't know
Right.
how it goes.
So what do you suggest? Just presence, being present?
Present, yes. Take good care of yourself.
Right.
If you don't, then you're not good to yourself or anyone else.
Right. Wow.
Yeah.
So, Dr. Attar, I want to, thank you so much. You've given us so much information and knowledge. I did want to ask you another quick question, though. Is there any particular case that you can remember that was such a satisfying experience where you saw that, they maybe recovered in a way that you suggested or they had a good experience and it just was a gratifying experience? Is there anything in particular maybe or patient that you remember that stays on your mind that you would like to share with us an experience?
I had a patient with transverse myelitis.
Okay.
That it's a injury, a problem with the spine.
Okay.
She was basically chair-bound,
Wow.
wheelchair-bound.
Wow.
And she was young.
Okay.
She was in her maybe 50s at the time.
Yeah, that's
And
young.
she had multiple medical problems, including very bad COPD, chronic bronchitis,
A lot going on.
problem with aspiration on top of her COPD, diabetes, chronic kidney problem.
Wow.
She had the whole 9 yards.
So we have 1 minute left. What
Oh,
was the
okay.
takeaway? What's
The
the
takeaway is she ended up in the hospital in ICU, intubated, and we managed to get her out of there, and she lived another 30 years?
Wow.
Or not 30, I'm sorry. Maybe another 20 years.
That's an amazing
But
story.
in and out of the hospital, in and out of these
Right.
problems.
Right. But you were able to give her
Yes.
some more extensive life.
20 years.
That's amazing. Thank you so much,
You're
Dr.
welcome.
Attar. You did such a wonderful job. Thank you
Thank
for
you.
tuning in, everybody. Look forward to seeing you next week for another episode of You and Your Doctor. Have a great night. Take care.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-2